Welcome to the Thinking Practitioner Podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til Luchau.
Welcome to the Thinking Practitioner. And the Thinking Practitioner Podcast is supported by ABMP, the Associated Bodywork and Massage Professionals. ABMP membership gives professional practitioners like you a package including individual liability insurance, free continuing education, quick reference apps, online scheduling, and payments with Pocket Suite, as well as much more.
ABMP CE courses, podcasts, and Massage and Bodywork magazine always feature expert voices and new perspectives in the profession, including myself, Til Luchau, and my companion, you, Whitney Lowe. Thinking Practitioner listeners can save on joining ABMP at abmp.com/thinking. And coming up on October 1st, 2024, ABMP will host you, Whitney, and me, Til, and Dr. Joy Edwards for a special CE summit focused on low back pain. This online event, including 3 hours of CE, is free for everybody in the profession, not just members. Members can have access to the recording, but everybody can come to the live presentation for free and get the CE there. And in celebration of that, that's what we're talking about today. And it's a pleasure to see you and to discuss these ideas, Whitney.
All right, that sounds great. Well, looking forward to having a good discussion on it.
Well, we're going to take our different perspectives. We're going to compare, preview, contrast, and then we'll talk about, again, what we're going to share at the summit itself. But I like some of the questions you've put in our roster for today, our agenda for today, and I'm looking forward to digging into those. How about we start with its prevalence, or how common is it? How common is low back pain?
Yeah, I certainly think it's, I think from world experience and looking at the stats, very, very common. You got some stats, I think, on the percentages of it, and that's similar to what I had put in a recent article too. Upwards of 60 to 70% of people have some episode of low back pain at some point in their lives, and many of them have recurrent pain. And the stats, I should pull this back up. I don't remember off the top of my head. The economic impact of that also is just gargantuan in terms of the millions and millions of dollars spent on trying to address low back pain.
That's right. Leading cause of disability worldwide, too, gets in the way of people being able to do their daily lives more than anything else in the world.
Yeah.
And the biggest reason that, or one of the most common reasons that people come to healthcare providers for help.
Yep. Mm-hmm. Yeah. As we were thinking about this, I was thinking about how prevalent this is. I don't know why. I just had this flash of memory. You might probably remember this. We're of the same age group to remember. Do you remember commercials back in
Spinal Tap? Is that what you're talking about?
No, this is back way before. This is like the 60s, I think, for Doan's pills. DOAN, Doan's pills.
Yeah.
It was a remedy for back pain that was pretty. I don't know what was in those things, but I remember just hearing commercials about them all the time for dealing with your back pain.
Okay, they are not a sponsor of the show.
That's right.
But that's a great association. Yeah, lots of remedies out there, lots of things being tried.
Yeah.
Forever for this back pain question.
Yeah.
The stat I found every year, about 15 to 30% of people, adults, experience low back pain.
Yeah. And it's amazing, as frequent and as common as that is, that we have not found better and more consistent solutions for addressing it at this point of our modern healthcare evolution.
That's right. There's so much research that's been done and is being done, and it's still such a big problem that you can get your grant approved by making it about back pain, because there's so much interest and need for that help.
Yeah. So out of curiosity, before we move on, I'm just to ask you this question, because I ponder about it. I mean, there are people who point to the idea, and I'd like to hear your opinion on, we don't know, because we can't ask, for example, quadruped animals if they have low back pain, but there's a lot of suspicion that the prevalence and sort of epidemic of low back pain has something to do with us becoming bipedal and standing upright and walking around. Like,
that's one of the
what
narratives.
Do you think about that? Yeah.
What do I think about that? That makes some kind of sense. I don't know how to test it. Mm-hmm. But the idea that if you go with evolution, which many of us do, it's this idea that we evolved in a horizontal spine, and then we've become upright. So these structures that originally were functional, either swimming in the ocean or crawling on the land, are now vertical masts. That sounds like a recipe for some challenges.
Yeah.
Sounds right to me. Uh, there's an interesting, just pulling trivia out of my storage closet in my brain. There is no scoliosis amongst any other species except humans, except for congenital deformities. But
Hmm.
like adult or adolescent onset scoliosis doesn't happen in animals. It's a
Yeah.
human thing.
Yeah. And that makes sense for some degree of functional development of functional scoliosis because of those stresses of the vertical column, the vertical spinal column. That certainly does tend to make sense that would develop there.
Yeah. And maybe
Yeah.
that hurts. That
Yeah.
just hurts. Who knows?
Yeah. And, interesting when you look into some of these statistics too, there's some other important considerations that I don't think make it into the stats a lot that need to be
Uh,
considered, especially when you look at some of the um, different demographics of back pain amongst different cultures.
oh,
And we find, back pain is not as prevalent in certain cultures, but I think a lot of times there's cultural overlays about that. And one of the stories I love, this is a story Doug Nelson tells.
uh-huh.
He is of Scandinavian descent, and Doug, pardon me if I get this wrong, but I believe it's Norwegian that he's from, but where his family is from. He said one time, yeah, there's a common thing in their culture of saying that, like, yeah, this hurt so much I almost said something about it. And so, for a lot
Yes.
of these cultures, talking about a reporting pain is
Yeah.
not common. So there's
That's
probably
part
some
of what
degree
we're
of
comparing when we compare cultures.
underreporting, yeah,
That's
of
right.
some of those things in certain cultures.
We're we're comparing cultural expressiveness about pain as much as pain itself.
Yeah.
That's an interesting thought. I do remember some research, and this was in my second book, I think, about uh, correlating uh, spinal curves and hip mobility with back pain. And this was a bunch of work done in Japan, where at this time people were sitting on the floor a lot more still
Yeah.
and had much more hip flexion available to them than the average European or Westerner.
And that also has some things, if I'm understanding correctly, too, to do with depth of the acetabulum, depth of hip sockets, and the capability to
Orientation,
get down
perhaps. Yeah,
into those
also, are
squatting
they,
positions. Yeah.
that's right. Are the
Yeah.
acetabula pointing out to the side? Are they
Yeah.
pointing ahead? There's a lot of variation amongst that between people.
Yeah.
That's right.
Yeah. So,
Well, what are you have a article coming out. I look forward to seeing that. You've been doing some thinking about this. What do you see as the common causes of low back pain that we see in our work, and especially how can we address those things as hands-on therapists, massage therapists, etc.?
yeah, this is interesting. When when I was looking up some of the stats on what the causes of low back pain are, there's a lot of things that are reported very consistently of causes of back pain: disc protrusions, pressing on nerve roots,
Mm,
spondylolisthesis,
mm,
sprains and strains, and some other soft tissue injuries. But it is interesting the way that those things get reported, because people like to have a diagnostic category for naming these conditions to
yeah,
report them as causes of low back pain.
yes.
And I personally believe that some of the very most common causes of low back pain don't fit into a lot of those categories, which is just the
Mm,
muscular overuse low back pain isn't really, it's not a strain because we don't have overstretched or torn muscle fibers.
mhm.
And the sort of muscular hypertonicity doesn't come up as a diagnosis
Right.
for back pain complaints in a lot of instances. So it's really, I think there's again some skewing to those statistics and causes of what produces back pain. And I saw this a lot in, especially in the clinical world when I was working back in the orthopedic clinic, back with Emory University in particular,
Uh,
of the number of people who would come in with a diagnosis, and their diagnostic label was lumbar sprain/strain.
yes.
And, the more I learned about all this stuff, the more I started realizing, well, there's a big difference between a sprain and a strain. One is focusing
Mm,
on ligamentous tissue and one is focusing on muscular tissues. And
mhm.
how do we really determine which of those is the primary problem, if there is a primary one, and what's really, how do we direct our treatment toward that?
And
So,
we're describing pain-inducing phenomena in terms of physical damage, which is only an indirect relationship anyway.
yeah.
So there's probably a whole lot of back pain related to soft tissues in some ways that
Yeah.
wouldn't fall into the, like you said, the sprain or strain category. They're not either severe enough or maybe don't even involve a physical injury or damage. It might be more of a sensitization phenomenon.
Absolutely. And this was all way before the whole pain science thing
Right,
was coming around. So I think
right.
everybody's, I don't know if everybody, but the vast majority of people were looking at this through a
Yes.
mechanistic lens of we got to find a mechanical cause of what this back pain is. And
And
so,
then when we find that, we can be mechanics and fix the mechanical problem, and back
yeah,
pain will be gone. Wouldn't
yeah,
that be nice?
yeah.
You're reminding me of a presentation Frank Willard did at the Fascial Congress before the one you and I went to, maybe let's say 2016 or
Mhm.
2018, Berlin. He did his own research, and it was fairly extensive, although it was he gave all the usual disclaimers about his own research. And he said that maybe 60, 70% of back pain has a myofascial component or a soft tissue component,
Mhm.
he was saying. And he was saying what we used to assume was true for 80% of back pain, disc issues. As recently as 3 decades ago, people were saying 80% of back pain was related to disc issues.
Yeah.
He said current research points to about 4% that being
I
directly
would tend
related.
to agree with that. I think that's a lot more realistic. There's a
Yeah.
really good discussion of this whole historical trend in Gordon Waddell's book, The Back
Mhm.
Pain Revolution,
Right, right.
when he refers to the dynasty of the disc,
That's it.
and that there
That's
was
the story. Yeah.
a good several decades of focus on blaming the disc for a lot of those back pain complaints. And I think we're now recognized, especially now with the advent of the MRI and
Yes.
the fact that we identify so many people with no back pain who have some pretty significant structural challenges in there with
Mhm.
disc status that we can't really make those kind of assumptions any longer. And that
Right.
really points to the critical necessity, I think, of comprehensive evaluations and
Mm.
comprehensive assessments of what's really going on there, and not just an assumption, looking at some imaging things automatically.
Well, Stewart McGill would agree with you on
Yeah,
that. He's really the king of the thorough evaluation for
yeah,
sure.
yeah, certainly. And
Did,
there's been some backlash against some of the things that Stuart McGill has advocated, because he does tend to focus a great deal on saying that there's almost always a cause that can be found if you're thorough enough.
okay, yeah,
Um,
his
eh,
statement is there's probably no such thing as non-specific back pain
yeah,
without an identifiable cause. And
yeah,
I'm probably oversimplifying it, but he says if my eval is thorough enough, I can pin it down to some kind of mechanical cause.
yeah. And I think I would have to say I'm not really in that camp, because
Oh,
I think there are quite a number of conditions of back pain that don't have something mechanical that is causing them.
mm,
And this is the whole psychosocial component of what might be producing back pain from, historical things that happened to somebody previously, or just that's where their pain is getting generated from, but not necessarily through a mechanical cause.
yeah.
I listened, I went back and I was listening to some of the things that we had when we were talking about in that episode, and I was, had
We've had
been,
him on twice. Yeah,
I
if
had
you
him on
say that, we
twice.
should
Yeah.
thank him again for coming. But what did you
Yeah.
hear? What was it?
Yeah. Well, this also came out of some discussions. I had an episode a couple weeks ago with Laurel Beaversdorf and Sarah Court, and,
Hmm.
we had talked about that some. They had discussed that on their podcast a good bit too, just that excluding people with sort of a non-mechanical cause, systemic disorders, major systemic illnesses or things like that might manifest in back pain, things like fibromyalgia, all those kinds of things
Mm,
can manifest in
mm,
back pain. And you're not going to find a mechanical cause for a lot of those
mhm,
people.
mhm,
So, neural sensitivity,
mhm,
and that's why, again, I was saying it's so critical, I think, that we be comprehensive in our evaluation and assessment process. So taking a comprehensive and thorough history can begin to tease apart what might be of mechanical origin and what might be of a non-mechanical origin.
mhm, mm. And if it's a mechanical origin, do we work it differently than non-mechanical?
Yeah, that's a big question. I would certainly tend to probably work in a different way about those
Okay.
things, because I would tend to think, again, this, on a case-by-case basis, it's going to differ, but I would say as a general guideline for a non-mechanical issue, I would probably tend to work less in a targeted and focused direction toward a specific tissue orientation, and more towards a generalized reduce the nervous system, nociceptive activity comprehensively kind of thing.
All right.
It's just, what about you?
Yeah, I think I would go with that in terms of specificity or general thinking. But I think I'm a bit more agnostic in terms of this question of causes. And maybe that's just because I don't know that I have the patience or specificity to do a Stewart McGill kind of 2.5 hour evaluation where we get every single movement and every single bit of history and put that together into a grand unified theory of someone's back pain.
Yeah.
I think I can actually find useful things to work with without the Newtonian universe being deconstructed to clockwork. In other words, maybe finding movements that are provoking of the pain.
Yeah.
And thinking about pain as an experience itself and divorcing it for a second from possible mechanical cause. We can do a lot to soothe pain, to change someone's reaction around pain. And the fact that maybe pain is a reaction in of itself, when we shift the way someone reacts to a sensation in their back, we've shifted their pain.
Yeah.
And so I also keep in mind for myself, I'm kind of getting into our next question here, but that there's so many different things that can contribute to the experience of back pain that aren't local.
Yeah.
Can I talk about those for a second?
Yeah. I was going to ask you to expand on that a little bit, because you brought some interesting things up and talking about that.
Well, it started for me with Bogduk, spinal researcher, pretty well known. I believe this was in the 90s or 2000s, coming out with a study where he systematically would anesthetize different structures in the back of people with back pain and get them to report on their pain. And he kind of categorized it down to different things in the back were responsible for this percentage of people back pain that we see in the clinic. And his assessment was that at least a sixth, about 15% of people coming in saying they have low back pain, got better, didn't feel pain when he would numb out their SI joints. And so he's saying, well, that's a big contributor. And then Taguchi in the 2000s, this made a big splash in the fascial research field. He was testing the sensitivity of the thoracolumbar fascia, which is thought from that perspective, in the fascial perspective, to be a probable source for a lot of back pain. So he went through and mapped out through irritating with saline solution and maybe think electrodes perhaps, where on this thoracolumbar fascia do people feel back pain and where do they report it?
Yeah.
And he found that there's huge overlaps in both people's reporting, but also in the neurology, which neurons have inputs from different structures. And he found that, I don't have the list here, but viscera was often experienced as a back pain, visceral pain, leg pain, hip pain, skin pain would sometimes be reported as something people felt and experienced as a back pain that point to their back. It hurts right there in my thoracolumbar fascia.
Yeah. Let me ask you a question, because this brought up something interesting. I can't remember the number, but quite a while ago, you and I did an episode where we talked about the homunculus.
Yes.
And the percentage of sensory input from different parts of the body, in particular, lips, fingers, hands, and those distal sensory things, super large in terms of the amount of sensory information that comes in. The back, not so much.
Not so big, not so huge.
That's also know, very difficult to tell 2-point discrimination on the back in terms of what that is. For people not familiar with that, is where you get 2 points of contact, like 2 little sharp tip ends of a compass or something like that. And how close can you put them together before you realize that there's 2 points and not just 1 point, or how far can you spread them apart? And
so it's like a measurement of tactile acuity, or your ability to feel accurately with that part of your body. Yeah.
And with the back, we just don't have very good 2-point discrimination at all. And it makes me wonder, like you were just saying here, how much of this might be a big part of misreporting from overlap of incorrect information that we're getting summarized in the central nervous system.
Yeah. Well, the homunculus, this is definitely a diversion, but I got to go there for a second. The homunculus turns out to have a lot of areas of overlap. I think we discussed that some in our episode
Mhm.
on it. And this 2-point discrimination thing, like our guest Mark Bishop talked about, is less accurate when there's pain. People
Yeah.
have to have the points much farther apart to tell there's two and not just one when they're in
Yeah.
pain. And so this idea of helping someone develop sensory acuity or being able to feel accurately has some theoretical potential to reduce people's pain.
Yeah.
And I don't know if that's been tested rigorously, but in my practice, that's a concept I use a lot. Can
Yeah.
I can I have someone report exactly where the edge of their pain is?
Mhm.
And I'll go out and work. I'm sorry, I'm still in this rabbit hole. I'll go out and work just the level of the skin with a
Mhm.
really light touch. And that's actually where we start our sciatica training, which I just got done with in Maine. But we started with just a really light touch on the skin, and you can really map with someone with back pain where the skin gets sensitive. You can find it out, almost like a dermatome chart.
Mhm.
It's not going to follow the typical dermatome shapes all the time. And then I will actually keep in mind that that's really changeable and plastic and moving all the time, both in the brain and its relationships, but on the skin. And we can actually, with patience and the right touch and the right invitations to the client, shift that sensitivity in the skin. And a lot of people report changes in their back pain too.
Yeah. And that's also very closely tied in with that idea of cortical smudging of,
Exactly.
especially
Exactly.
with back pain,
Yeah.
the difficulty of really being able to precisely tell or target where that pain is coming from. The worse the pain gets, the worse the discrimination seems to get about being able to identify exactly where that's coming from.
That's right.
Yeah.
So I can work with pain itself as a experience
Hmm.
and kind of taking a shortcut around the question of which structure is generating this pain
Yeah.
with the knowledge that it could be a lot of things and it might not be identifiable just by sensation.
Yeah. Mhm.
It's more of an empirical approach. What seems to make a difference here?
Right. You had some other people that you mentioned also
Mhm.
of being influential with some of your ideas
Yeah.
on this. Yeah.
Yeah. Stewart McGill, we mentioned
Mhm.
his specificity of his eval and his idea there's no non-specific back pain, but also his emphasis on stiffness
Mhm.
was, again, a mind puzzle for me because pretty compelling evidence and stories from clients of mine and other therapists I know who use his methods to find ways to manage their back pain through essentially cultivating stiffness.
Mhm.
I think that's probably my uh, kind of unquestioned bias towards softening and relaxing that came with my bodywork training.
Yeah. Mhm.
Physical therapists are more about strength and probably, coordination.
Yeah.
Us body workers think, oh, yeah, it's going to be better if we soften it.
Yep.
And turns out, yeah, in the back, probably not.
Mhm.
Yeah, at some point at least.
Yeah.
So, and I mentioned Paul Hodges there on my list that you're looking at.
Mhm.
Paul Hodges is an amazing researcher. I hope to get him on the show at some point.
Mhm.
But a lot of his early work was about motor control in the spine. And that's like a more refined way to say strength and coordination of the back.
Yeah.
And he really looked at the sequencing of things firing and the limitations of that model too. And he said, people really got out of control with the idea of core strength having to start with the multifidus and going through this exact sequence,
Mhm.
which is what people quoted him a lot in that kind of research. But he says it's not that lockstep, but there is some sort of control and coordination of back activation that we need.
Yeah.
So his ideas were influential. Do I use that in my work? I think it shifted me. He and Stewart McGill shifted me from thinking, let's just get in there deep and soften it
Mhm. Yeah.
in that sense.
And I think too that when you think about a lot of the discussions of, and a lot of this came out of the sort of pain science revolution, talking about pain being a protective mechanism,
Hmm.
that when we talk about motor control, a lot of times those back injuries, you've heard over and over again about the 300-pound pencil, like
No,
I
tell
didn't
me.
do anything. I just reached over to pick up
Ah,
this pencil and my back
right.
went out, somebody
Yes.
says. And I think
Yes.
that's getting into that whole idea of the motor controls. Like your back was pretty close to being at the level of fatigue, and something you did in that movement activity just
Hmm.
made it fearful that you do this one more time and I'm not going to be able to withstand this load. And so then the spasm comes along to protected. And I think that's really a motor control response that's in there doing that, like you mentioned.
Yeah, the motor control might be an expression of some sort of central nervous system sensitization or
Yeah.
protective responses being triggered too. That,
Yeah.
of course, the proponent of those ideas was Lorimer Moseley. He's also been a guest on the show. Thank you, Dr. Moseley, for coming in. But huge influence on my understanding of back pain.
Yeah.
And he was, interestingly enough, he was Paul Hodges' PhD student. Paul Hodges was his
Oh,
supervisor.
didn't know that.
And they,
Oh,
yeah, and
interesting.
they did some interesting. Todd Hargrove has a nice article about the two of them giving back-to-back lectures at a conference at some point. That I'll remember, see if I can put a link in the show notes or something, because they have different perspectives, but there's really an interesting dovetailing and mutuality there.
Yeah.
It's a view.
Yeah. Interesting.
The other name on my list, Helene Langevin, who's been on the show, and Stecco, who's also been a guest. We've had an amazing back pain guest roster already.
Yeah.
Their work collectively pointed to the role that tissue may play, especially thoracolumbar fascia may play and superficial fascia, where there's pretty clear correlation between thickness of those tissues and their mobility, their ability to glide, especially.
Yeah.
Not particularly stretch. And this is not saying, this is like not going to the debate about does fascia remodel. They're not talking remodel. They're talking about just the sliding and the thickness. And Dr. Stecco's research shows, at least in the neck fascia where he did it, that there's a pretty clear effect of manipulation toward both increasing the sliding and decreasing the thickness of those tissues, and that correlated with a reduction in pain.
That seems like that might also go along with your thoughts on stiffness too. That there's maybe some degree of a greater, well, not some degree, a greater degree of stability associated with those fascial tissues that are playing a bigger role in maintaining the stiffness and stability in the spine.
Well, he elucidated us when he visited about the complexity of that stiffness question and the role of hydration in that, and lots of factors beyond just a little bit of muscle contraction, which is from a massage therapy point of view what we might assume stiffness means, or a fascial density that we might assume from a fascial perspective is the stiffness.
Yeah. Right.
That's it. Those are my back pain influencers, and I think I take their concepts and ideas and try to apply them on the table in different ways. Yeah.
There's so much out there, so much that has been written about this. And again, a whole lot of opposing opinions, the people that say like, this is the solution, it was John Sarno was real big for a while with, looking at that whole thing, saying like, we're off on a completely wrong track here. And just, there seems to be some faddism periodically about something. We talked about the dynasty of the disc.
That's
and,
right. There's the story of that evolution.
Yeah,
that's right.
Yeah. There's certainly some faddism that goes along with these different places. And through it all, we still have lots of people challenged and unable to find really good solutions for what seems to be ailing them so frequently.
And it was the famous quote, maybe it was Sayers, maybe I'm getting that wrong, said that when there's a lot of remedies for a particular condition, it's because none of us really get it. None of us really have the answer.
Yeah. That's good. Yeah.
Yeah.
Yeah, I think that's good. And there was I talk about this study frequently, and I cannot remember the exact name of it, but there was this came out maybe like early 90s or something like that. And I think it was talking about in the cervical area. It was either cervical or low back region, but the study was about the different approaches that people take for addressing this. And for example, they were making the comment essentially that, if you're a chiropractor, it's a subluxation. If you're an acupuncturist, it's a chi flow blockage. If you're a massage therapist, it's, muscle tightness or whatever. And
if you're a carpenter, it's a nail.
That's right. Yeah. If this study was something like, who you see is what you have, or what you have is who you see. And there is a certain element of that too, that I think that is out there, that we all have something that can be potentially beneficial in doing that. And it gets me thinking about our discussions about the descending modulation. We had an episode that we focused on this, and it's like, maybe really that's what most of us are doing. If all these things work for certain people, maybe that's more of what the reality is of what's actually making the changes in a lot of those situations. And
I got a story about that, if I could. And a study. There was a study comparing different practitioners' model of spinal biomechanics, because there's some very opposing principles of spinal biomechanics that are taught in different schools.
Yeah.
Some said when you side bend this way, it bend rotates that way. Some say exactly the opposite.
Mhm.
And so they tested these different practitioners who were trained in these different schools on they didn't test the outcomes because almost all the outcome studies show that method is not really related to outcome. But what they tested was these practitioners' confidence that they had made a difference for their client.
Yeah.
And they said, do what you're trained in, and then do the opposite of what you're trained in.
Hmm.
Which one do you have more confidence made a difference for your client?
Yeah.
And as you can predict, the ones that people were trained in, confidence was huge.
Yep. Hmm.
So there's this role for the narrative we hold as practitioners and our confidence in it and how it makes sense to us or resonates with us or has some sort of integrity for us, being a lever for our own sense of confidence in what we're doing, which, as we know, the practitioner confidence actually does have a lot of non-specific benefit
And
for
that
the
gets back
actual
to,
client's
yeah,
experience.
that gets back to our discussion with Mark Bishop too about
Yeah,
the impact
right.
in the outcomes and how that is influenced significantly by confidence levels of both the practitioner and the client that is experiencing that as well. And
I had
when there's
yeah.
all these there's a lot of discussions currently in our fields, in our rehab fields, about how important it is how important the technique is. Is it really important? Does technique really do what we say it does? And
Mhm.
unfortunately, I think what some people get out of that discussion is that the technique doesn't matter.
Technical nihilism. It
Yeah,
doesn't matter if the techniques compare
right.
equally. Why does it even matter what we do? Let's just
Yeah.
not
And
even do it or do whatever.
my discussion about that is like, I think that's missing the point
Mm.
of what they're saying, because I think they do matter for this very reason, that your confidence levels and your ability to get your client engaged in that therapeutic alliance with you by what you're doing is greatly influenced by how effective you think you're going to be with using those particular techniques. And so I think it does matter significant.
Yes.
Probably not in the way that we think it does, but I do think it matters.
Yeah. Yeah. If it didn't matter at all, I mean, I'm completely on board with the concept underneath that, but the conclusion that the technique doesn't matter, my job would be a lot easier when I'm teaching a workshop because
Yeah.
I'm giving lots of input about the hows, and it's mostly the how, not even where, what we're working on, but how
Yeah.
we do it seems
Hmm.
to make such a huge difference. And that's not easy to learn
Yeah.
or not easy to teach. And there's a lot that matters there
Yeah.
for getting the results that we're looking for and our clients are looking for too.
Yeah. And, we have to think too, and you and I both have to grapple with this as educators, that, we probably do certain things a particular way because our body does it comfortably.
Yeah.
And then I know, when I'm trying to teach the same technique to a 6'3",
Uh-huh.
very tall person with very long limbs who
That's
doesn't
right.
have that, degree of finesse of technique that I can do maybe as a smaller person or something, that doesn't
That's
work
right.
for them. Or when I'm trying to teach this same technique to
Yes.
a young person that's 5'1" and 110 pounds, they can't do that sort of thing that we've just done. So you've got to find a way that works for you in doing those particular types of things. And this is certainly true when you deal with things like low back area, where you may be trying to do movement oriented things along with some of the
Uh-huh.
stuff that you're doing with
That's right. There
soft
could be
tissue
some.
manipulations. It can be
Mhm.
super challenging, I think.
It's a big area. Especially if you're moving limbs around and things like that, it could demand a certain physicality.
Yeah.
So you're saying when we look for CE, we should look for a teacher that matches our stature physically.
Right.
Or,
If they know how to use their stature correctly,
okay,
maybe.
yeah. Or has a faculty diverse enough.
Yeah.
Shameless plug here for our faculty.
Okay. Right.
Diverse enough in their size and approach that you can look for some universality in the approach. Doesn't
Yeah.
depend on somebody's
Okay.
size. Yeah.
So in a nutshell, we can say size matters here on something,
Okay.
on this aspect
All right.
to a degree. Yeah.
What else are we going to talk about?
Yeah. Let's see. Yeah. Tell
Oh,
me about, what were you
I
gonna
was going to
say?
tell you. I was going to tell you my story, my recent
Yeah. I
back
was gonna
pain
say, tell me,
story.
you had a story. We were going to talk a little bit about, like, have you had back pain yourself? Yeah. Tell me a story there.
Yeah, this trip to Maine I mentioned, it was up to go see Tom Myers and teach at
Mm.
his summer program. It was really fun. I drove like after I got done teaching there. It's my first time back in the classroom for quite a while too, so I was kind of tired out. I really enjoyed it, but it was more exhausting than I was used to. Pretty tired. Sat in the car and drove for 4 hours in New England traffic. And then went and visited a friend, slept in their very soft bed. And I woke up in the morning and I had like one spot of low back pain off to the side somewhere, maybe a transverse process or who knows. I thought that's interesting. So I did some movement and that didn't really reduce it. Went kayaking with my friend that day. We kayaked for most of the day. And when I got back, it was pretty sore. And getting up, getting down, bending over, it's like, oh, okay, I'm doing my homework for this conversation I'm having with Whitney
Yeah.
and this seminar I'm going to teach for the ABMP. And any of us who've been through an actual symptom that our clients come with us for help with, really get how the experience of it is so different from the other side of the
Yeah.
relationship. So
Yeah.
there I was really hurting and not able to find comfort in all of my clever movement practices and different things like that.
Hmm.
Uh, so rest helped. Oh, I went for a walk later the next day. That helped. And then I saw a friend of mine, a practitioner, Andrew Shire. I can say his name because I asked him. He lives in that area, and I've known him forever. He does a kind of energy work
Hmm.
called attunement, and very experienced at this. And it's not my model. It's not how I tend to think about things in the overt way. I don't think of myself as an energy worker. He really does unapologetically and is very skilled at it. And the experience was uh, very pleasant, very expansive, very relaxing. And wouldn't you know, when I stood up, there was not much back pain.
Hmm.
Go figure.
Yeah.
And so when I ask him about that, he says, I'm just listening to your energy field in his terms and not trying to fix it, not trying to change it.
Hmm.
I'm just bringing it into connection with my own energy field, his term again. And that togetherness or that resonance helps it regulate.
Yeah.
And I think I could probably translate that into maybe a relationship language or something like that that I would be more my vocabulary. The way that we get rapport, say, with clients by attuning to them, by aligning with them, by taking the time to listen and really getting on their page.
Yeah.
Even though I don't think about it in the same energetic terms he was describing, I think it's easy for me to translate that into an approach
Hmm.
that I could take through the rapport or the therapeutic relationship or something like that.
Yeah.
And in this case, that was enough, darn it. Yeah.
It really begs that interesting question, like, what is the mechanism of change in so many of these different instances? Is there a
Yes.
right thing and like something you would never probably have chosen or thought about initially as the solution turns
Yes.
out to be something that makes a significant change in there? And so, you know, what is it?
There you go.
It's just the right time, the right place, the right way for something to be done there that worked.
Yeah. Yeah.
Hmm.
And I think his skill and the context was all part of that too.
Yeah.
That's right.
So
How about
what's
you? Have you had any formative back pain experiences?
Yeah, your story made me think of something in particular that's on the opposite end of a spectrum. And I'm curious to hear your take on this too,
Okay.
because we see so many of our clients have back pain that is the result of an overuse of the back, like what you described there with
Mm.
doing the kayak and a lot of those physical activities.
Mhm.
And I was thinking about like a back pain episode of my own that I remember significantly was about immobility. So the flip side of that,
Mm.
not overusing my back, but underusing it or maybe overusing it in a degree of static,
Mm.
constant contraction. And this was
Sure.
a few years back. I was driving up and taking one of our cars back up to when we were living up in Alaska. So I was driving from Oregon to Alaska, which is 3,000 miles and probably 5 days
That's a
in the
long ways.
car, 14-hour driving days constantly. And I just had, by the time I was done, most horrendous back pain. The seats in this particular car were not very good. And you're
Mm.
sitting there for, long periods. And I was driving about 14 hours each of those days.
Jeez.
So it was very long driving sections of just being immobile. And I would get out periodically, try to stretch, try to move around, but it was never enough. And it got
Mhm.
so bad. And then as soon as I got there, I was actually supposed to go back down to Canada. I was teaching at one of the Canadian massage conferences or something like that.
Uh-huh.
I had to wear a back brace to teach, and
Oh.
I was in a tremendous amount of pain, just standing or moving, just to like
Oh.
reach down to do something a certain way, and then all of a sudden it would seize up. That whole fear thing of making it
Yes.
do that. And so
Yes.
in that instance, eventually the solution for that is movement, is moving within a safe, protected manner to gradually
Mhm.
sort of convince my back that movement is okay. But it is interesting. I had, try to work on myself with the Theracane, had people work on me and things like that. And
Yes.
like those things were helpful, but eventually just kind of what does it is moving safely
Mm,
and
mm,
comfortably. And so I think that's a frequent issue with a lot of the muscle overuse, either overusing or like in this instance, overusing constant isometric contraction, probably
mm.
from the posture
Driving.
that I was sitting with. Yeah.
Yes.
Because I have a feeling I have a typical forward head posture when I drive, and just
Mm.
like a back and pelvic tilting, probably not the ideal position, so that I'm just tense, somewhat to driving and
Okay,
keeping
so
it close.
wait a minute. Posture does matter?
I think posture matters. That I go back to that quote again. Posture is not necessarily a cause of back pain, except when it is,
Gotcha.
So in that instance, I do think it matters,
Uh-huh.
under certain circumstances. So
Sure.
yeah,
No, that makes sense to me too.
yeah,
There's that debate, of course, and maybe it's just in social media, maybe it's elsewhere, that posture is hard to correlate with
hmm
pain.
yeah,
But there's stories like this, certainly in my own experience too, that where it can make a difference to how we sit, our body awareness, that kind of thing.
yeah. Yeah, I was talking with several people about this recently too, and we are saying like, with that debate that we see all the time on social media about this,
Uh-huh.
discussion about structuralism and posture and does it really matter? And I think part of the problem is if you take posture as an isolated factor, it
Hmm.
probably doesn't matter that much.
Uh-huh.
It's posture plus load,
Yeah. Okay.
because you can have an aberrant posture of scoliosis or, pelvis distortions or whatever they are, and you don't overload them, and it's not that big a deal. It doesn't really make that much difference, but you
Mm.
overload something with a poor posture, and now you're putting a significant stress on the whole system that is going to reduce or is going to result in a pain complaint.
I bet Stewart McGill would agree.
Yeah.
So posture plus load times duration, maybe how long you
Yeah.
stay there. And then
Yeah.
also there's another multiplier in there, which is probably context.
hmm
Is this something that you're in a protective state or are you in a adaptive state? Those kind of questions are probably going to influence how that manifests as pain or not
Yeah.
too.
Yeah.
All
So
right. How important do you think it is to educate our clients about some of these specific aspects?
I do think this helps a lot, because especially with things like ergonomic challenges with a workstation or something like that, these are things that are particularly relevant and beneficial of, getting somebody some suggestions of things to do. One of the bigger problems that I see along these lines is that as massage and manual therapists, this is not always in our ballpark of things we're well educated on. The ergonomic things do require a fair amount of kinesiological knowledge, to look at these various different factors, and stretching and exercise and recommendations about how to do particular types of exercise and movement things. Not something that a lot of us get really good training in unless we do specialized training in it
Right.
after we get out of school. And
Yes.
certainly are plenty of people who do that. But I do want to just sort of call to everybody's attention that just because you are a manual therapist doesn't necessarily mean you have a good grounded knowledge in movement
Motor
oriented
control. Yeah,
things
that's right.
to give people suggestions about. And so that's the
Mhm.
encouragement to learn some more, really to,
Learn some more or have referral resources or know the
yeah,
limits of our scope. I mean, that's become clearer to me the longer I practice.
yeah,
I'm pretty good at some stuff, and there's other stuff that I'm not that good at and haven't spent that much time with or don't embody in the same way in my own body. And it's better
yeah,
to hook somebody up with another person who can really help them.
yeah. Yeah, again, back to that episode a couple ones back where I had that conversation with Laurel and Sarah, and we were talking
Yes.
about scope of practice versus scope of expertise. Um,
Mm,
and there is a difference because something can be within your scope of practice of something that you could be doing, but it's not within your scope of expertise of something that you're really highly skilled at this point of where you are in your development. So be wary and attentive to those two different types of boundaries, because I think I see them as a circle within a circle, you know.
Well, and it goes the other way too, doesn't it? Something I could be really good at might not be within the contract I have with my client.
Yeah.
So as a massage therapist, giving someone, I don't know, psychological advice, perhaps,
Yeah.
or who knows? There's lots of examples like that.
Yeah. So those things are a bit fluid and fluctuating. So, and they require a fair amount of metacognition of thinking about your own self and your own skill sets and your own boundary levels of what you're
boundary
appropriate
levels.
at. Yeah.
What the therapeutic agreement is.
Yeah.
All those kinds of things. That's right.
Yeah.
Okay. Anything else you want to talk about?
I think we hit a lot of the main things that we were wanting to zero in on. So again, an encouragement to folks to, if you're listening to this before early October, which hopefully you get a chance to, then would encourage you to hop on over to the Low Back Pain Summit, and we'll be exploring some other things. And what are you going to be talking about at the summit?
Yeah, I'm gonna my presentation. I'm number two. You get to be number one. You get to open us up. But as number two presenter that day, I'm focusing on application. Like, what are the hands-on things we can do for low back pain?
Yeah.
And it's basically a deeper dive into some of the ideas that we've mentioned here today, systematically going through them and finding ways to apply those to an actual back pain scenario.
Yeah.
That's basically what I'm gonna do.
Yeah.
How about you? What do you cover?
I'm going to talk a bit about some of the things that were in the article that I will have coming out at the beginning of I think it's September, October issue. Some of the primary causes of low back pain, to kind of go over them just as setting the groundwork. And then going to talk about some treatment strategies for those things as well, like what kinds of things would tend to be more appropriate for each of those different kinds of problems in more general senses, not necessarily with a recipe or protocol, but just some important guidelines and also some very important red flags to be watching out for in our attempts to treat people there.
Well, I get to follow you, so if I listen to your lecture and I realize I'm doing it all wrong, I'm going to pull my presentation and just start over
and do it on the fly.
Right? That's it.
Yeah. Okay. We'll see how that goes.
Looking forward to that. That's right.
Yeah. I don't get that benefit of being able to learn from what everybody else did first and then change things. But
easier maybe in some ways. Easier.
Yeah. So okay. Well, that sounds good. Obviously, lots of other things that we could dive into here, but we want to just sort of touch base on some of those, and I think we got some good stuff in here, and maybe we'll put some links to a few of the other resources and people that we mentioned in the presentation here as well.
Check out the show notes. Yeah.
So, okay.
Closing sponsor. Who's
today it's Books of Discovery, and they have been a part of massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. They do like to say that learning adventures start here, and find that same spirit here on the Thinking Practitioner podcast, and are proud to support our work, knowing that we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that advances our profession.
Instructors of manual therapy education programs can request complimentary copies of Books of Discovery's textbooks. They're pretty cool. What an offer to review for use in their programs. Please reach out at booksofdiscovery.com. Listeners, that's you listening, can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com, where Thinking Practitioner listeners save 15% by entering thinking at checkout.
And thank you to all of you listeners hanging out with us today. We do want to say our thanks to you for hanging out and staying with the show and checking some things out and giving us ideas about things that you'd like to hear more about. You can stop by our sites for the video, show notes, transcripts, and any extras. You can find that over on my site at academyofclinicalmassage.com. And Til, where can they find that with you?
My site, advanced-trainings.com. As Whitney mentioned, if you have comments or questions or things, your feedback for us, anything you want to hear us talk about, just send us an email or record a short voice memo on your phone and email it to us at info@thethinkingpractitioner.com, or look for us on social media. My name is Til Luchau. That's how you find me on social media. Whitney, where can people find you?
People can find me also under my name. They will not find me on TikTok. I'm not on that social channel. Some other
Yes,
things
me
like
neither.
that, I won't be over there. But other places you can find me under my name there as well. You can also rate us on Apple Podcasts, as it helps other people find the show. And you can hear us wherever you happen to listen on your favorite podcast app. Please do share the word and tell a friend. And we will look forward to seeing you in the next episode.
Thanks, Whitney.
All right, we'll see you then.